Well, hi, grade 9 students. It's Mr. Krente here, and today we're starting to talk about substance use and abuse. And the first thing we want to talk about is drug use. First of all, is this a relevant topic for you? Hands up if you are a drug user. Don't worry, nobody's looking. I have my hand up, and every one of you should have your hand up too. Now, that might shock you a little bit. You might think, Mr. Krente, I'm not a drug user. What are you talking about? Or how dare you? Or how do you know about my personal life? Because here's what I think most of you thought of when I said the word drug user is you thought of drugs that are maybe illegal or illegal for you. And you thought about maybe alcohol or marijuana or maybe even harder drugs, quote unquote harder drugs that we see around us. So that might have been your thought. And you were thinking, maybe I don't use that stuff. Here's the first thing I want you to know about drug use, and it's this. Everyone is a drug user. Everyone is a drug user. That sounds a bit of a shocker, and there may be some people out there that will go natural their entire life, but here's the reality, that I'm pretty sure that every single one of you at some point in your life will take a drug. And some of you, I'm sure, have already taken drugs. Now, what drugs are we talking about? We're probably talking at this point about things that you would say are good for you, or maybe good drugs. Maybe you've had a fever and you've taken Tylenol. Maybe you've had a Coke yesterday and you ingested caffeine. Amphetamines and caffeine. These are all drugs that we commonly use in our society. And a lot of us use them for very good reasons, for medical purposes, or for, because they're in products that we enjoy and are safe for us. But they are still drugs. And I think one of the first things that we need to knock down is the idea that there's good drugs and then there's bad drugs. If we are all understanding the way drugs operate, we know that all drugs can be harmful. And that's our point number 2. It's this. All drugs have the potential for abuse. All drugs have the potential for abuse. We know that all drugs have effects on our bodies and on our minds. If we take drugs in a way that they're not intended to, then they can have a significant impact on us. And it doesn't matter how you categorize the drugs, good or bad, the drugs can have an effect. I have a quick story. When I was a teacher a number of years ago, I had a student who was in the office, and I got called down on a first aid call, and that student was loopy and very out of it, feeling sick and really not doing very well. We were considering calling an ambulance. And we went through a number of things like, did you sleep last night? Did you eat properly? Like, what's going on? And not me, but another teacher that was there said, did you take anything this morning? And the student said, yes, I took some Tylenol, and something I'm sure we've all taken. And we said, well, when did you take it? Well, between classes. How many did you take? Well, I took 10. 10 Tylenol is not going to do good things to your body at all. But it's a quote unquote safe drug. Here's an interesting kind of add-on to that. We asked, why did you take 10 Tylenol? And she said, I was having a bad day. See, and that's drug abuse, right? That's when we start using it and it has negative consequences. And a lot of that is for the emotional pain or bad days that we're having. People turn to substances in order to make themselves feel better. And they figure, well, if 2 Tylenol make me feel good as a painkiller, then maybe 10 will make me feel even better, which we know is just not the case. So we have to start with that fact, because the reality is that a lot of our drug abuse is coming from substances that are out there, are legal, and are available to many, many people. Very rarely are we going to see people start abusing drugs that are illegal, or kind of way out there on the spectrum of addictive properties. We have to start recognizing the fact that every one of us is a drug user. So when you go to ingest a substance, you have to be aware this substance has the potential to harm me if I don't use it right. I have to use it right. So if you start with that, then a lot of the harm that comes from drugs starts to dissipate when we recognize that all drugs also have the potential for abuse. I know that I want to keep my body healthy. If I treat this in a wrong way, then we will have some problems later on. So recognize that. I hope every single one of you can recognize the fact that, I use drugs in a healthy way to help me when I'm sick, that are in different products that are safe for me. But I hope you handle them in such a way that you think about, all of these drugs have the potential to cause me harm if I don't use it right. The reality is that the fastest growing addiction in Canada is legal prescription painkillers. That's the fastest growing. And these are drugs that for many of us, we could get prescribed by a doctor. And the only problem is when we don't use them properly. So that leads me to my next point. The most abused drugs in Canada are legal for adults. They're legal. They're allowed. You can take them, you can buy them, you can, in some cases, they are told to you, you should probably take these. So the most abused drugs in Canada, number one by far is alcohol. And of course, we know that for adults, alcohol is a legal substance that we can purchase. Number two is tobacco. Cigarette use is declining in Canada, but a number of people still use tobacco products. And of course, vaping has become a popular alternative to tobacco use, but that is still up there as one of the most abused drugs in Canada. Number three is marijuana, which has recently become legal in Canada. And number four, I said the fastest rising, and the one that gets a lot of press is prescription opioids. So when we think of the opioid crisis, we know that those opioids are things that people can get legally through a doctor, but when they start to become addicted to them and they start to overwhelm different aspects of their body, they cause a lot of premature death in Canada. So all of these drugs are legal. You're able to have them, but they're the ones that also cause the most harm. They have the most negative consequences to our health, and in some cases, to our relationships or to our healthcare system. These cause a lot of damage. So we don't look at these either as safe drugs. We just look at all drugs as drugs that can be used in a proper way and drugs that can be abused. Now, of course, some drugs have more addictive properties than others, but it really comes down to the situation and a few of the topics we'll talk about in a second. For example, your prescription opioids, you might be thinking of something really bad called fentanyl. And of course, we've heard a lot about fentanyl in the media and the way that it impacts many people's lives for the negative. My wife gives fentanyl to people. She does it in a very legal and safe way. She's a nurse in a cancer ward in the Ottawa hospital, and her cancer patients experience pain to the degree that they are given fentanyl in a patch, and it is attached to their arm, and they receive that very, very highly painkiller type of opioid, but in a safe clinical setting. It's the same fentanyl that people might use on the street. It just depends on the situation and, of course, the controls that we put around it. So it's important to understand Everyone is a drug user. All drugs have the potential for abuse. So we have to look at them all in a really careful light. And we have to recognize that the most abused drugs, the drugs that cause the most negative consequences in Canada, are all legal for adults. Now, caveat, why do you think that they are not legal for you? And of course, being smart students, you know that your brain is still developing. It's developing at a rate that it hasn't been developing since you were about 2 or 3 years old, because you've hit puberty. And it will continue to grow and develop really rapidly up until you're about the age in your early 20s. So your brain is rapidly growing. And if we put a substance in there in your brain that interferes with that growth, plays havoc with your brain, which all abused drugs can do, then we're going to start to see limited brain growth, and that limited brain growth or distorted brain growth can continue on into your later life. So we know that there's a place for having limits for age in order to protect growing brains in you guys. So it's another really important thing to think about, is the way that these substances will impact you has a much higher sensitivity than it would impact adults, even though it will still impact adults' brains, just not quite the same way. Think of babies that are in utero and things like fetal alcohol syndrome. A little bit of alcohol is why pregnant women are told absolutely no alcohol, so that those really fast developing babies don't get any impact to their brain. And your brain's growing in a similar way, and you need to be able to protect that. So that's why we want to keep you away from drug abuse. One of the many reasons. What is drug abuse? So what's the difference between use and abuse? Okay, sir, you've got me, I'm a drug user, okay. But why is this a big deal? Why are we handling these things carefully, because they're dangerous? Well, we want you to avoid drug abuse. Everyone's going to use drugs, and we're going to talk about how do we do that in a safe, healthy way. But when we talk about drug abuse, that's the place we don't want anybody to go. And it doesn't matter if the drug abuse is alcohol or marijuana or prescriptions you get from your doctor. Even if it's something like caffeine, we don't want you to go down the road of abuse for any drug. Because drug abuse is when someone experiences negative consequences of drug use and continues to use. So if your use of drugs all of a sudden starts to have negative impacts on you continuously, that's a problem. That's if it continues to have negative impacts on your health, your physical health, if it has negative impacts on your mental health, if it starts to have negative impacts on your relationships, if it starts to impact the way that you perform at school or in some of the activities that you do, if you're starting to experience negative consequences and you're still like, you know what, I know this is damaging me and harmful to me and to the people around me, but I'm going to keep doing it anyways, and you don't make a change, that's when it starts to be abuse, and that's when we really see those negative consequences ramp up around drugs. And that's the place we don't want anyone to go. We don't want anyone to experience harm because of drugs. We want all of any use of drugs to be safe and to be helpful. Now, what does that look like? What's the difference between drug use and drug abuse? Well, here's a few ideas. Number one, healthy, safe drug use means one thing it can mean is that the use is under medical supervision. So if I'm using a drug and a doctor prescribes it to me, that's something I can take because the doctor knows this is what I should be taking, how I should be taking it. And really important, if you get a prescription from a doctor, then you should be taking the amount that the prescription says and the timing the prescription says. If it says take 2 pills every 4 hours, that's exactly what you should be doing. You shouldn't be taking more. More doesn't mean you'll get better faster. does not mean that. And you shouldn't be taking it more often thinking you'll get better faster. It doesn't happen like that either. So take exactly how the prescription says to take a drug. And it's important if you take over-the-counter medication, on the back there's always going to be a label that says, or on a bottle there's always going to be a label that says this is how much you should take. And even look at your age. So sometimes it's different from adults and youth. So you need to look at those specifics to make sure that you're doing it safely under medical, supervision in a way that's healthy for you. If you're experiencing drug abuse, you're often taking those same substances that you could be prescribed and you're using them, beyond the limits. You're self-medicating for pain. You're not using it under a supervised doctor's advice or health professional's advice. You are using it to self-medicate for pain. You're deciding how much you should take. You're deciding how much, painkiller you should take. You're deciding how much alcohol you should take. And it's usually taking it such that it helps you feel better in a very short-term sense. Like you kind of, if you get inebriated, you get drunk, and all of a sudden, whoa, I feel temporarily kind of out of my problems. That's like self-medicating, trying to deal with pain, maybe physical pain, maybe emotional pain, and trying to deal with it, and taking substances that you think make you feel better. And that's a big difference between taking it under doctor supervised advice. Drug use has healthy limits. Drug use has healthy limits. So like I said, if it's a prescription, then you're going to follow exactly what the prescription says. And that's the limit for that particular drug. So you make sure you stay within that limit. What about something that's not prescription, but is legal? Obviously, we're not any illegal drug. We would say zero, nothing. That's partly why they're illegal. But what about some of these legal drugs we're talking about? What about alcohol? The Health Canada has put out what they recommend as safe drinking guidelines for adults. This is for adults only. For any youth, anyone under the legal drinking age, 19 in Ontario, 18 in Quebec. It's absolutely nothing, no tolerance. Like we said, it impacts your developing brain. For adults, people over the legal drinking age, they recommend, Health Canada says that one standard drink a day would be what they might consider a safe limit. So we're looking at a standard drink as being a glass of wine or a can of beer or a small shot of harder liquor. One of those standard drinks per day meets Canada's safe drinking guideline. Obviously, there's other scenarios where alcohol is absolutely no alcohol when operating vehicles, no alcohol for pregnant women. And so there's definitely limits around alcohol. And going beyond those limits is where we would say abuse might start. Tobacco, there's no Health Canada recommendation for a safe level of tobacco. It's very addictive, and we really haven't, we only see negative consequences of tobacco use. Marijuana is still being studied. I don't have a definitive answer from Health Canada as to what they would recommend for marijuana. Safe to say, it's a very low dose, but I don't have anything to really back up what that would be. It's at this point something that we're only starting to study because it's only become legal in recent years. So use has healthy limits, and you have to stay within those limits for any type of drug use to be safe. And like we said, some drugs, there's no healthy limit. You just can't take anything in order for it to be healthy. Of course, with abuse, limits are exceeded, limits are ignored. So I go beyond the limits. I take more of the drug than is recommended on the bottle. I exceed that one alcohol standard drink per day that Health Canada says is a safe guideline for adults. Those would be exceeding limits, and where we start to see negative consequences happen because of our drug use. So that's when drug abuse would start to occur. Another part of drug use would be overall positive consequences. So healthy drug use looks like, a doctor prescribing me a medication. I take it according to the prescription's guidelines, and I feel better from whatever I'm being prescribed for, and I have a positive consequence with that. Of course, there's always side effects too with different medications that you can experience, and some of those might be a negative consequence. But in the end, the positive consequence outweighs the negative side effects, small negative side effects, and we experience an overall positive result from the drug use. That would be using drugs in a healthy way. We experience positive, overall consequences. Drug abuse looks like overall negative consequences. So when my drug use starts to impact the parts of our life that we said before, our health, if I start to use a substance and it starts to, just continually worsen my health rather than improve my health, if it starts to have a negative impact on my mental health overall rather than a positive impact, if I start to damage my relationships because of the use of the drug, and I've experienced all of these overall negative consequences, that's when we're in the area of abuse. Lastly, no cravings. So drug use, if I use a drug in a certain way that is safe for me, that is healthy for me, I'm going to be able to walk away from the drug and go, okay, I'm glad I'm done that prescription, it's over, and I'm moving on from that. Or, if I like to have, something like caffeine, there's healthy limits for that too. Like adults who have a cup of coffee a day, and then just, that's it. I have my one coffee, and there's no continual cravings for more. I don't want more of the painkiller. I don't want, constantly more and more and more of the caffeine. If that's healthy drug use. So when I have no cravings for it and I can walk away from it, I can use it for its purpose, but then, walk away from it healthy and safe, then that's what healthy drug use looks like. Drug abuse, though, looks like there's cravings. Like I've taken this, and then, a little while later, I'm like, I really feel like having this again. When can I have this again? And maybe you even start to organize your life around when you can use it again. That's what kind of drug abuse looks like. I'm starting to crave it, and I find it hard to walk away from the cravings that I have. And that's where obviously addiction starts to take hold, when these cravings start to really take over our lives and start to, we start to organize our lives around the substance, and those cravings take hold. So I hope you got a little bit out of this lesson, looking at the fact that, we really do want everyone to be safe. We know that you're going to use drugs in your lifetime, and we want you to do it in the best, healthiest way possible. And so please look at the different aspects here, review them if you need to. And we want to prevent you from going to the side of abuse. And what you're going to look at next is some risk factors for abuse and some protective factors for abuse. So what that means is, what puts us more at risk to be at this side of the equation, to be on the abuse side. There are certain things that can exist in our life that can kind of push us towards being more at risk to abuse drugs. And then what are some protective factors? What are some things in our life that will keep us on this side, on the safe, healthy drug use side of things? So that's what you're going to look at next. And thanks for watching.